Hi, my name is Beatrice. I am the overnight supervisor here at Southeastveterinaryneuro Neurology, and today I'm going to be teaching you how to properly take care of a post-op patient. Picking up your pet post-operatively can be one of the most intimidating parts of post-operative care, but the main thing to remember is just to keep the spine aligned and straight. To pick up your pet post-operatively, you want to slip one hand under the two thoracic limbs and one hand under the two pelvic limbs, keeping the back aligned and then lifting up slowly. You also want to make sure that you're meeting your pet on the ground so that they're less excited and not jumping up on you. One of the most important aspects of post-operative care is going to be cage resting. Cage resting is incredibly important because we want to make sure that our pet does not re-injure themselves. When your pet comes home, you want to make sure that you have a kennel already available to them. This kennel should be large enough where the patient can be comfortable inside and they can move away from their urine if needed, but not too big that they might do excess exercise and re-injure themselves. In this kennel, you want to make sure that you have water available at all times, and you want to make sure that you have a food bowl available for appropriate feeding times. The patient should be kennel rested for about 4 to 6 weeks. For at-home bladder care, we want to make sure that we are expressing the patient every 4 to 6 hours. For a tutorial on how to express a bladder, you can refer to our How to Express a Bladder tutorial video. If the patient is urinating on themselves or is overflowing on themselves, we want to make sure that we keep them nice and clean to avoid urine scalding. We can do that using something like a waterless shampoo and a gentle microfiber cloth. Incision care is also a big part of post-operative care. The main thing to keep in mind at home is keeping the incision clean, dry, and intact. If you notice any discharge, foul odor, swelling, or redness, please give us a call. At home, we can also provide some level of physical therapy. We will send you home with a yoga mat for traction, a sling for the sling walks, and a little baggie to hold your goodies. At home, you can make sure that the patient remains comfortable by providing stretching to all 4 limbs. We can also provide massages to decrease stress, and we can provide passive range of motion to make sure that we have continued mobility. Okay, so now we are going to show you guys how to place a help them up harness. We use these for large breed dogs. We have some in hospital with us that we use on our inpatients, and we also have some in case you want to take one to go home. These harnesses come in multiple different sizes, and they also come in male and female. Archie here is a male, so we're going to be placing the male harness on him. We're going to begin with the front part of the harness. So it's just going to go over his head like this. And then we are just going to strap on the 2 bottom straps, just like you would a regular harness. So 1, and then 2. And that is how you place the front part of the harness. Okay, so now we are going to place the back part of the harness. This back part will attach to the front part of the harness, like so. And then we will place this part. So these little straps here will come between his tail. We'll snap them in like this. And then these 2 will come on the inside, and then these parts will snap in on the side like so, and same thing on the other side. Once you have this already on the patient, we can go ahead and make any adjustments we need. Sometimes the harnesses might be a little bit loose. We want them to be snug, but not too tight that the patient's uncomfortable. Okay, so the great thing about the hop-em-up harness is that you can do this yourself, or if you have a second person, you can also use a second person. So Melissa here will hold the front for me and I'll hold the back, and keeping even pressure on both sides, keeping the spine even, we will go ahead and walk Archie forward. Come on, Archie. Good job. Good boy. Post-operative care at home can be quite challenging and takes practice. We hope that this video provided additional guidance. If you have any further questions, you can contact us at Southeast Veterinary Neurology, and we're always happy to help.